All right, so thank you for attending this webinar on something that is hotly debated in the chiropractic profession. I deal with robotic laser enhanced spinal decompression. My name is Dr. Mark Jagger. For those of you who don't know me already, I designed a device called the Spine Specialist, which is a robotic simultaneous combination of class 4 laser therapy and spinal decompression. The thing I get a lot of it, some of our Facebook comments, some of the things related in the profession, what I get often is, well, what you do is not chiropractic. And I have some people put some pretty scathing comments with respect to that, and that, you're diluting the profession, you're this, you're that. I go, well, my perspective is always that we set an oath at the beginning of our doctorship that said that we would help patients in any way that we could. And so my perspective has always been chiropractic is what I am. It's what I do, but it's not the only thing I do. Because as a chiropractor, with my knowledge as a chiropractor, my job is to help that patient. And if I know that there's other ways to help my patient that I don't necessarily do, or that are not actually chiropractic, my responsibility to help that patient doesn't end at my knowledge. I'm going to give you a little example here. A lot of doctors, medical doctors, community, I practice in Ontario, Canada, and just outside of Toronto. And I find a lot of the medical professionals, if they don't know what to do with you, they just slough you off. I had a patient the other day. She had a ligament injury, medial collateral ligament. Followed the pattern of medial collateral ligament injury, the mechanism, the anatomical location, everything said medial collateral ligament, sprain strain, inflamed, etc. She wanted imaging. So she goes to the hospital actually to get imaging. I told her to maybe grab an ultrasound because it'll give us a little more imaging on the soft tissue. X-ray will do nothing. So ideally MRI is great, right? But ultrasound, we can get an ultrasound quicker. MRIs take a few months in Ontario to get most of the time. So she goes and asks for an ultrasound. The doctor says, ultrasound won't tell us anything. Here's some naproxen, and here's a requisition for an MRI. MRI will take about 3 months to get, so take the pills for now. So she calls me and she says, oh my God, I'm so pissed off. This doctor, within the first 3 minutes, gave me a anti-inflammatory, gave me naproxen prescription, and told me to go get an MRI, and told me that ultrasound will do nothing, won't tell us anything. I'm like, wow, that blows me away, because in the 30-some years I've been in the healthcare profession, I was under the impression that ultrasound did soft tissue imaging. Might be able to see some inflammation possibly. I don't know. Maybe I didn't pay attention in class. Maybe I've been led down the garden path for 30 years, thinking that ultrasound actually had a use in medicine, had a use in diagnostics, but apparently it does not, because this medical doctor says that it doesn't. But I'll tell you what really happened. He doesn't know what to do with her. He told her it was a meniscal problem, wrong anatomical location. Not that it's impossible, but it's unlikely, just by the area that we know it is. So he didn't know what to do with her. Frankly, he didn't care. So he said, here's some pills, because that's what I know I can give you right now. Here's an MRI requisition that I know probably your knee will be better by the time you get this anyways. But the problem is he doesn't realize, or maybe he didn't realize, that the worst case scenario of this is the patient takes the pills, needs stronger pills later, gets hooked on something, while waiting for that MRI, because she doesn't know what to do, because the doctor, who's the professional, was supposed to tell her the right thing to do. And he didn't. He put her in a position where she could potentially have a serious problem with addictive medication and depression because she's not getting better. Still wait for this MRI. Still waiting for this MRI. I don't know what to do. If she didn't have me to call, That's the road she would have gone down. That's the road a lot of people go down when they get addicted to medications. That's the road a lot of people go down first when they get depressed and they get discouraged about their painful condition. If that doctor had given her the ultrasound and said, go to physio even, how much extra time would that have taken? My problem is he probably didn't care, or he didn't know what he was doing. Those two things are very, very problematic, to understate it, problematic. I've seen patients go down that dark road many, many times, and that's why I do what I do. That's why I use other modalities to help the patient. So here's what we did with this patient. She called me, she came in, we did acupuncture and laser on the ligament. She woke up the next morning feeling 25 to 30% better than she did the day before. She came in the next couple days. She's doing a lot better now. She's not 100% better, but she's on the road to it. She's not taking the medications. She didn't want to in the first place. But had she been the type that didn't know anything else to do, can you imagine what road that could have been for her? And I've had patients come in addicted to narcotic medications because the first doctor that saw them didn't care enough to send them to the right place. So, and as a chiropractor, I could adjust the knee, I could do soft tissue work, all that type of thing, but my laser does a lot more than my hands can do. And if she can get a faster result, more effective result, her faith in what I do is much better. And you know what? It makes me feel great. I'm staying true to my oath because I'm able to give her a solution. And if I couldn't give her a solution, say I'm the chiropractor that wants to just keep adjusting and that's all I want to do, that's great. But you got to recognize the fact there are referrals that you can give to that patient to get them to a place where they can get better faster. We've all heard the situation where patients come for care for a year and not got better. In the first 2 months of that care, there probably should have been something else enacted. If the first thing isn't working in a generally predictable manner, if you just keep doing and doing and doing the same thing over and over again, expecting a different result, that's the definition of insanity. That's why we need to have our minds open to tools that will help our patients. Doesn't matter if we agree that it's chiropractic or not. Doesn't matter if we want to do it or not. Doesn't matter if somebody else wants to do it or not. Our responsibility is to that patient. Our responsibility is to make sure that that patient gets where they need to go to get the relief that they need to get. Because if they don't, this downward spiral happens. We've all seen it. We've all seen this situation where a patient goes dark. I've had patients that have died of overdoses. That's a terrible, terrible thing. And, hard for me is that at the time, it was earlier on in my career that a couple actually had 2 people in that situation. And all my thought process was, I wish I could have done more for them. So this is why I explore more modalities, because it gives me more that I can do for them. So do I believe in chiropractic philosophy and the fact that the adjustment is a beautiful thing? Absolutely. But do I believe that in the absence of that working, that I should have other tools to help this patient with? Absolutely. And if I didn't, I need to have somewhere to send them. Look at it in the medical profession. Your GP sends to a specialist. Why? Because the specialist is a more knowledgeable thing on a smaller amount of information. That's really the way the chiropractic profession should be as well, because we can't know everything about everything. The adjustment can't be the be-all and end-all of everything on the planet, despite, some people think that it is. It's a great thing, but it's not everything. You have limitation of matter. We learned that very early in our education. Limitation of matter is why the body stops being able to heal itself. So what do we do when we hit that? We need something to give the body a little bit of a jump to make sure that it can start healing itself again. So really, this is what all these modalities are, is assistance to the body so the body can do the things that it needs to do to heal itself. The adjustment helps with that, but if you can accelerate that, that's better for the patient, that's better for you as a doctor. That's just better for everybody. So when you have a patient in front of you that needs your help, you really got to be able to be patient-centered. Less of what I want to give them, more of what I think they need. And this is why the mind needs to be open to that. The fact that the oath you took was to help patients means that your mind needs to be open to the new and different things that happen, that show up technology-wise and technique-wise, to be able to accomplish that. So I was very against technology when I first came into practice. But I saw what it can do for people. I experienced it myself. I have Sherman's disease, as some of you that have heard me talk before have heard my story. Chiropractic wasn't working for that anymore. In fact, it was making me worse. It was getting me worse headaches. It was making me throw up. I have very limited neck motion, partly because of hockey and taking a lot of hits to the head, partly because of the Sherman's disease itself. So I lived the fact that chiropractic couldn't help me. Decompression and laser was the thing that helped me and kept me working so I can continue to work with patients and do what I love. So that's my story. That's why I got into the decompression and why I built the robotic laser enhanced spinal decompression system on its own. It was an evolution of what I found worked for me. And it was an evolution of what doctors could offer as technology evolved. So just like, before, using laptops and phones, two separate pieces of equipment, a certain computer company decided that, hey, what if we can have the portability of a phone and the strength of a computer all in one? That's where the iPad came from. Taking a couple technologies that were great on their own and putting them together to make something that will speak to a different part of the population. And that's what we've done with the decompression and laser. Just a general evolution of what we were doing before. So being open-minded to technologies like that, Shockwave works incredibly well. Where my expertise is essentially knowing how to apply all these different modalities to patients and to help a practice. Because really this is what I've done, is I've purchased a lot of different equipment over the years to be able to help patients in different ways. So I have a tool for anything a patient might show up with. If you need to hammer a nail, a screwdriver is not doing you any good. If you need to put a screw in, well, you can do it with a hammer, but that's a whole other conversation. Having the right tool for the job is super, super important. So that's why I feel the practice of the future needs to have all these different technological modalities to help beyond what we can do with our hands, because it can augment what we do with our hands. It can improve our results. And really at the end of the day, that's what we're trying to do, isn't it? Improve results to make sure that the patient gets exactly what they need, so they know you're the one to go to on a business front and on a clinical front. And so they get the relief that they deserve. That's really the key right there. So I'll close it with a quote. I've used this before, but it really encapsulates my entire feeling on developing your practice and developing your craft. If you want something that you've never had, you got to do something that you've never done. So if you've never had high-end technology in your practice, but you want to help more patients, adding the tech is the way to go. If you want to fix more things that other people can't fix, you need a new tool to be able to do that. You need to do things you haven't done before to get results that you haven't achieved before. That's kind of where I come in. So to close the webinar, if you want advice on what you could do to augment your practice, might be something I provide, it might be something I can advise you on. Either way, if I'm able to help you, that's what I'm here for. Helping you helps thousands and thousands of patients that you will touch, and that is my number one goal, to help millions of patients that I'll never see to have better lives, more pain-free lives, and it will help millions of family members as well. Thanks so much for watching, and look forward to our next webinar.